Jessica.
Hello, hello.
I am so excited to have you here. So we basically kind of said hello offline, and now we're back online, and we're going to spend some time talking about yoga therapy today.
Woohoo.
So, yeah. So, Jessica Buck, you are a certified yoga therapist.
Yes, I am. Yeah,
How,
here.
yeah, could you tell us a little bit about your journey to becoming a yoga therapist?
For sure. So, I am a yoga therapist here based in New York, not the city, more in a town called Warwick, New York. And I've been offering yoga therapy sessions in person and online since August of this past year. I completed the wonderful program from Maryland University of Integrative Health with this beautiful woman here hosting this podcast. And we were in a cohort together, and it was just such an enriching learning experience getting involved in the path of yoga therapy. You could probably attest to this too, but it's been such a learning experience and growth process, but also such a beautiful space to be in healthcare right now, yoga therapy. It is an emerging profession, but it really fills the gaps where maybe traditional places of healthcare might fall short. Yeah, I've really loved getting to explore more of like the insight that comes from yoga therapy sessions that a person is able to discover that jewel within themselves almost, the more soulful part, you could say, but in a therapeutic context. That's been one of my most favorite parts.
That is an amazing thing to see. When we were talking prior to the interview, one of the words that came up for me personally was when you see somebody become empowered, in their own self-worth and value, what a gift that is. And we get to be on that journey with them. And when we see it, it's an amazing thing. So,
Yes, truly. And there's a freedom that comes from that. And when you see a person able to overcome that sense of adversity and suffering in a way in their life and see them not rise above it, but to move through it, to emerge as that more strengthened and empowered part of themselves that has always been there, but they just needed to see that other person to help open up that aspect of themselves. I think that is a true gift to
mhm,
be in this type of role that you get to hold that person's hand and be that guide in their own transformation. I think yoga therapy is such a transformative process, right? It's like you think of
yeah.
like a piece of coal and you think of how it becomes that diamond. There it has to go through that not always pressure, but there's that sense of transformation, that alchemization that happens through that process. And it's such an amazing journey for some of the people I've worked with.
Yeah. It's interesting that you use the coal because when I used to work with kids, I would actually use the analogy of the diamond and, the different facets because sometimes they'd be like, well, you know, I'm not that or I'm this. And I'm like, no, you're multifaceted, which
Mm,
again, part of yoga therapy is we are looking at them as multifaceted, integrative, holistic.
mm.
Um, so with that, how would you describe yoga therapy for somebody who doesn't know what yoga therapy is?
Yeah. So I guess building off of what you said from the multifaceted lens, I think that's a perfect segue into what is yoga therapy. I guess from that perspective, yoga therapy really is a therapeutic process where someone is able to engage with their physical, mental, emotional, spiritual, and wise self. We look at in yoga therapy the person is comprised of five different and fluid parts: our physical body, our mental body, our emotional, our wisdom body, and our bliss body, our sense of meaning and purpose. And yoga therapy helps you not access just like traditional talk therapy where you're accessing a lot of the mind and emotion, but you're able to bring in maybe more of a spiritual aspect or something. And maybe spiritual doesn't resonate with everyone, but a sense of meaning or a sense of purpose. Maybe
Mhm.
explore with a sense of curiosity what someone values and understand that intrinsic value and what that motivates someone to attain. So, yoga therapy is a transformative exploration of the multiple layers of yourself in a therapeutic setting that combines the Western lens of having those evidence-based practices while also retaining that sense of wisdom and maybe more of that Eastern philosophical perspective where you can hold space for the sacred and the vulnerability, but also the integrative and scientific lessons that come from um, the beautiful healthcare we have now here in the United
Yeah,
States.
absolutely. It's interesting because as I've been interviewing people and I, had this thought process in school as well, is that each of us, even though we're on the same path to becoming, yoga therapists and now being yoga therapists, even though there are pieces that we, share that are very much in common, right?
Yeah.
The people that we meet are going to be very individual, just as we are very
Mhm.
individual as yoga therapists. And so, with that, I know that when we were talking a few months ago, there were some definite areas that you were more geared towards. And I thought maybe you can share those areas with us.
Yeah, definitely. Uh, my areas that I like to focus on in my practice, or maybe ones not necessarily that I like to focus on, but seem to be attracted to the work that I do, are people who maybe are struggling with a bit more of like mental challenges, and maybe people who are maybe there's been a divide in their sense of connection to themselves. So I notice in a lot of the work I do, I'm working with people's like wisdom body, their sense of values, their sense of discriminative wisdom, being able to experience a sense of discernment, setting boundaries. So I notice, especially when I'm working with people who maybe have more challenges with their mental health, whether it be mood disorders, premenstrual dysphoric disorder is one of my specialties, PMDD. Um, women's health challenges is also something I've been working with because there is such a special place in my journey and also my work that I really have made a space in my practice in working with women of all ages, specifically related to their sense of femininity and their um, just sense of connection to their feminine qualities. And we all have maybe a different perspective on what is feminine. And there can be a real strength in that because in that you get to see, that contrast between the yin and the yang aspects of ourselves, the one that is maybe really driven and ambitious, but then with our feminine aspect, we can really help hold our sense of drive and to feel nurtured by our sense of self and to feel beautiful and confident in our just individuality. And maybe that gets lost along the way. So that's a big part of my work is helping women and people with mental health challenges find a way to reconnect to them sense of self, feel empowered, and feel like they have the capacity to engage with life in a meaningful and purposeful way. So that is a huge part of my mission and my work. And recently, actually, I've been working with teenagers and adolescents. So that has been a real gift and a new chapter of my yoga therapy business that I'm excited to grow.
I'm excited to hear how that goes.
Thank you.
I honestly am really excited for you. So, one of the things that you were bringing up is people with mental health, and I wanted to explore this a little bit because this podcast is really about helping people to understand what yoga therapy is, how we differ from traditional, like say, psychotherapy, the Western medicine that's out there. Like, what makes us different from a physical therapist to a mental therapist? So, we do not diagnose, right?
Mm.
So if somebody comes to you and says, I have a diagnosis, right? What are some of the things that you feel or have experienced that have differed from the Western medical system and what we provide and kind of like that integrative
Mm.
piece?
Mm. That is such a beautiful question. But it also is so interesting to hear you say that because we are what I think and I see as yoga therapy, we do fill the gaps that might be missing in Western medicine. And I think that's the true beauty of it. But when it comes to looking at someone who maybe comes in with a diagnosis already, we take that as a piece of information, not that that diagnosis is the whole person. And I think that's what makes it very different. Yoga therapy as a whole is that we see a person as the whole person that they are. And maybe this diagnosis, it is contributing to a sense of discomfort and distress in their body. And we look at it in that's one part. It's not the whole story, right? It's like there is this environment that is the physical body. And for some reason, they have this challenge that is in their life now, and that being like a diagnosis, which not saying that all diagnoses can be challenging, but sometimes a diagnosis can bring in a changed perspective of someone's just identity. And I think as a yoga therapist, it's our job to help someone see that they are not who this person's identity is not their diagnosis. A
Mhm.
diagnosis is a part of this person's story, but it's not the whole story. And that's something that we really work on as yoga therapists is helping people see that they can disentangle from this sense of feeling attached to maybe the less than perfect aspects of themselves so they can see that they are a whole person. While they may experience a challenging condition, they are not that condition. So to help them
Right.
reconnect to who they are, that sense of being that is not uh, changed by having a condition. It's that steadfast part of themselves, that aspect of their being that cannot be changed, even if they have a condition. So that's kind of where we get to. It's that more deeper aspect, if that makes sense.
Well, to me, it makes sense.
Yes.
And I will say that it was beautifully stated. So thank you for that because I do feel that, when when you get a diagnosis, for some people, it could be almost a relief,
Mm,
that
that's so true.
uh right. So it can be a relief. Oh, it's this, right?
Yeah.
Or it's that. Um, but it can also be consuming, you
Yes.
know, and in our line of work and what we do, you know, as you said, we help them to see kind of beyond that, doing the collaborative work that we do.
Mhm.
And they become so much more because we are so much more.
Yes, exactly.
So that's a wonderful um, job that we have. Um, in your journey of being a yoga therapist, what would be like your biggest, how can I put this? Like if you just met somebody on the street, the only thought that comes into my head right now is your elevator speech, but you know, what would be that 1 or 2 minute conversation that you might have with somebody and explaining, the process of yoga therapy?
Hmm. Okay. Bringing me back to our program here. We did do a lot of work with this to make it short and succinct. So let's see. I think if I met someone and I would share with them, okay, what is yoga therapy off the bat? Huh. I might need a moment to think about that one. Uh, I could be a little long-winded. So I think, hmm, with yoga therapy, one of the main importance is the therapeutic relationship. So it is a co-collaborative experience. So as the therapist, we are not doing all of the work. We really need the presence of the person we're working with to be able to co-create the entire experience. So it's a transformational therapeutic process where someone is able to engage with multiple parts of themselves in therapy and not be so worried about what happened to them in their past, but to meet and greet themselves in the present and learn to accept where they are so that way they can start to develop the coping mechanisms with us being their guide to help them kind of move through change. So we in yoga therapy, we are really working with someone through change. We are professionals in helping someone move through change. And I think that's where we really differ from like psychotherapists, where psychotherapists and maybe other types of counseling can deal with more so like the past experience that someone has navigated through, especially from the perspective of trauma, maybe talking about trauma, but we don't our intention is never to like re-traumatize someone who has gone through like a challenging past. And we don't actually necessarily even have to bring up uh the details of someone's past unless someone feels comfortable sharing. It is not our role to be more like a talk therapist and go into the nitty-gritty details of someone's past, but to learn how to work with the nervous system that they are experiencing from when they meet us in that present moment and how to help them find a sense of comfort in their body so they can learn to live in their body in a more embodied and meaningful way.
Yeah, yeah, I like that. You know, one of the things that you brought up earlier, you spoke about, the physiologies of the breathing.
Mm,
We do work with the body. We use breath, different types of breath in yoga therapy. We call it pranayama, the different types of breath, right? To help balance the nervous system, to increase energy, to decrease energy in some ways too, because of the sympathetic nervous system, right? And I think that the one thing that always comes back to me, time and time again, is we try to create a balance, right? And then there's the physical aspect of it, because as yoga therapists, our background is we've all gone through,
yeah.
our yoga training from our 200 to our 500, to the 800 plus, right? Depending on how much yoga that you were, in the past, and we will continue to do because we are certified. So we will continue on that journey of learning, which I
Yes.
think you and I have a love for, a
Oh,
mutual love for
yes.
learning. So the physical piece, I was just thinking about this the other day. So often, people have not just the emotional piece, but the physical piece, if not the physical and the emotional piece of having these painful processes in their lives, right? Where we have the chronic pain and we don't always look at it and go, oh, it's your posture, right?
Yeah.
But that chronic pain impacts how people are living in their day-to-day life. Somebody who is, experiencing a lot of emotional trauma, it may be, in fact, also impacting their stomach, right? And so, I mean, I know some of the tools that we use, but what are some of the tools that you often use or like to use in your day-to-day practice?
Yeah, and I think that's a huge part of what we do. We do have a toolbox of practices, practices that embody movement, the physicality of the somatic re-education practice of the
Mhm.
nervous system that we learned. We have breathing practices, the pranayama, like you mentioned, meditation, awareness and insight building practices, mudras, hand gestures. The list goes on, and I feel like as we grow, we each can kind of bring our own spin on things too and integrate other aspects of that kind of more integrative approach that pertains to the different layers of ourself. I, in my practice, have integrated some of the internal family systems to help with the yin yoga therapy aspect, that we actually touched on a little bit, but I think that's been a beautiful um, kind of blossoming in my practice in general, just to further help women kind of connect with their deep-seated sense of connection to their more female aspects. But um, some practices I lean on a lot, and this is something that actually I was thinking about before we even came on, is such a big part of my practice, which is called like our sadhana, right? Our daily practice we connect to is writing. I think writing and having a contemplation practice, for me, that is the essence and the soul of yoga therapy. We have the physical, but for me and my work being so much related to, values, and I work a lot with the wisdom body, I won't lie, like that is kind of where I feel like my specialty has kind of become. Um, and developing that sense of confidence and empowerment, but having a contemplation practice. And what I mean by contemplation practice is maybe that looks like journaling to some people. Maybe that looks like walking outside and letting ideas kind of drop into your headspace and just feed that creative part of yourself that doesn't always get access to turn on. And when we're doing or completing tasks in our day-to-day life and as human beings, we need to be in the world and be responsible. But I think there's another part of us, and being yoga therapists, it's important we emphasize like we have to allow the people we work with to have that space to contemplate what is working in their life, what isn't, what do I need more of, maybe what can I do less of? And that's where like the yamas and niyamas and the ethical practice like comes in. For me, the ethical like virtues and the values to work with our sense of meaning is such a huge part of my work. And I cannot stress it enough, like how important it is to fortify our sense of confidence and sense of strength in whether it be virtues or a sense of like integrity, which I think comes from working with virtues and having space to reflect in your life. That can look like 10 minutes of journaling or writing, or like I said, walking and letting ideas just come to you, where you can contemplate your experience. It gives you space to exist. And I think when you
Yeah,
invite clients to do that, or the people you're working with, it invites them to suddenly exist in this more wise, compassionate way.
absolutely. Absolutely. And I think it also gives the space and that the rise for their own inner sense of who they are versus, who society tells them that they are, right?
Yes.
What their morals and values should be outside of themselves versus within themselves, which I do think is huge, you know. So
Yeah.
I appreciate that you work with the yamas and the niyamas and that idea of self-contemplation. Um, there's there's definitely a piece of that that kind of brings me back to this idea of, being able to connect with self also helps us to connect to others in a world that's very disconnected, you
Mm,
know? Yeah. And so I think this is a beautiful space to, sit in contemplation,
exactly. To
you
let yourself
know?
think and wander and just like pull together maybe the fragmented piece of your psyche and self. And it's
Yeah.
like, okay, to meet yourself and accept yourself. That's so
Right.
hard to like actually accept who
Yes.
you are today.
Mhm. And I think that, that's a really good, piece that I was also, touched when you said because, you know, we don't necessarily go into somebody's history. If they wanna bring it up, that is definitely part of what we do. We listen, right?
Yeah.
But we help to provide tools that can help people to build resilience and, check in on themselves and be able to move forward pretty much from the present on,
Yes.
right?
Yes.
And so, to meet yourself and be with yourself and honor yourself in that moment is a huge piece. I know when I am teaching my yoga classes, right?
Yeah.
That is something that I do invite my classes to do. It's like meet yourself here today because you're not the same person you were yesterday, and you're going to be a
Yeah.
different person tomorrow, and just for the women, like we from day to day, our hormones are shifting around, right? So we need to also honor the fact that maybe our balance is good one day and not so good the other, right?
That's so true. Like to see ourselves as the evolving kind of human beings we are, that we're not fixed. It's
Right.
like we have room to evolve and change and accept, every
Mhm.
stage of our life, not just one
Yeah.
version of ourselves per se.
Yes, exactly. And I do think that for people who don't know a lot about, where yoga and Ayurveda, came from, one of the things that the rishis did do is they watch nature, right? And
Mm.
nature is not stagnant.
Mm-hmm.
It's ever evolving, and for me personally, the fall is my favorite time of year because one, the sun's still out, but it's not really hot.
Yes.
But two, we get to see how, you know, the bushes, the trees, like they allow their leaves to fall. They're not sitting there like trying to hold on to every leaf.
Yes.
I want to have a leaf, right? Like they don't have that, which goes back to the yamas and the niyamas that you're speaking of. Um, again, because this actually made me think of something else, because we are in that space of, sharing what yoga therapy is, how would you describe? I know you said virtues and morals, but like if somebody were to look at you and go, well, what's a not a moral,
Yeah.
what's a yama and a niyama? Actually, somebody might say, what's morals, what's values, right? Like
Yeah.
how would you tell somebody that or
That's a
explain that
good
to somebody?
No, that's a great point because a lot of people might not know what the yamas and niyamas are. And if you asked me like a few years ago, I also wouldn't really know. But um, so what is an ethical practice? I think leaning onto ethics is basically kind of leaning on a sense of beliefs, things that can spark that intrinsic motivation. It could be concepts or ideas. I think a huge part of wisdom is having space to be inspired. And if you think of the breath, we are inspiring our bodies, inspiration and expiration. We are letting go of our breath. So really that physicality of inspiration, we're bringing in air, oxygen, but we're also bringing in ideas. When you're looking at like an ethical and values-based practice, you are allowing yourself to be inspired by ideas, words, context, concepts. But I think mainly it's beliefs. There's beliefs and virtues that give, life a sense of meaning, a sense of connection to be interpreted as important. And I think when it comes to anything related to like values work,
Mhm.
it's so unique to the individual because there are specific virtues you can work with in the yoga philosophy sense. It stems from a philosophical perspective to inspire and illuminate your mind to be with maybe a more, I don't know, be with more abstract concepts, but they're not abstract when you can ground them and interpret them in a way where you are able to embody the practices. I'll just give one for example, so it's a little more clear, but there's a virtue in yoga philosophy called ahimsa. Ahimsa also can translate to non-harming. When you hear that though, non-harming, that can be not harming others or not harming like yourself. Again, it's open to interpretation in a way to the individual hearing it because different people might experience that sense of non-harming in a very unique way. When I work with people, sometimes it's like the concept of accepting yourself. I'll just go back to that because we already brought it up. but like accepting yourself, that can be an ethical practice of kind of embodying ahimsa, being able to wake up in the morning and take 5 minutes to resource yourself and to check in with how you're feeling, giving yourself that 5 minute container to contemplate even. That is applying and embodying ahimsa and that non-harming nature, because also a little bit of non-stealing, that other virtue, to help yourself feel connected to that inner sanctuary. How do we establish ourselves in our own inner sanctuary? And I think that the being able to connect with that value in an embodied way, like in a physical way, but also in a way that sustains that sense of fire in yourself, that passion. That's where the values work comes in. And I think that's a pretty grounded way to look at it.
I think it is too. Thank you.
You're welcome.
I know I just did a month around ahimsa in my yoga classes recently, and it was a wonderful space to be in because I don't know that we often think of non-harming when it comes to ourselves,
Hmm.
and so many of us have actually had people, not the people that I work with in my practice, but my students actually say how impactful that's been for them
Mm,
because they think of non-harming in terms of outside of themselves, but not necessarily within themselves. And it can be so damaging,
mhm.
to some people when they're not um, being kind and they're
Yeah.
um, recently somebody said to me perfectionism. And
Mhm.
that's a huge one.
It
No,
is.
there's nothing in life that's perfect. I had a client one day. We were having a conversation and she was talking about how, she had to have her house, a certain way and it to be really clean and
Mm,
everything in place. And I asked her, because I could see outside her window, I could
yeah.
see these beautiful trees. And I
Mhm.
asked her to look outside and I said, is anything outside perfect? Right. And she looked, she was so cute. She looked, she's like, yeah, no. I'm like, no,
Mhm.
trees aren't symmetrical. They're not perfect. But when you look outside, you see nothing but beauty, and
Mm,
when we bring that inside, I love to tell people that we're imperfectly perfect.
yes. I think that is such an important lesson to show up to every day, is like to recognize where imperfection is, because to be human is to be imperfect, right? And like you said, nature reminds us that, and we can get so fixated, myself included, on feeling like we have to have everything perfect, understand everything that we're doing. And it's like, but when we can let go of the needing to control and to fix, that's another thing. Like needing to, yoga therapy is not needing to fix someone.
Right.
Like, not, we're not seeing someone and think, we never assume that just because you have a certain condition, it doesn't mean that the person you're in front of is broken. The person is never broken. A person can't be broken. They can have a broken bone, yes. We are not in that space to help with that, unfortunately. But um they are a whole, even if they're feeling broken. And I think that has been such a reframe. We work with reframing as yoga therapists. We can reframe a
Yes, we do.
person's perspective. And I think, to clarify, we are we are true guides in helping someone shift their perspective. So we do a lot of the reframing, motivational interviewing. We have learned how to speak in a certain way to elicit change behavior. That is a part of our training. So that's really important. And I want to emphasize the impact that a change in perspective can have for a person. Like you said, working with certain clients and working with that value of ahimsa, being able to communicate a perspective can spark that inspiration to suddenly create this new neural pathway that's like, okay,
Yes.
there's a possibility to have it different. there's a possibility to
Yeah.
maybe experience a different version of myself. And that is the beauty of where yoga therapy comes in and how it's so important because it helps someone shift their perspective and open up to the potential possibility of change, even if change feels scary.
Right. Right. And I love that you brought in that neural pathway and the repatterning
Yeah.
because, sometimes, I mean, our degree is a master's in science and clinical yoga therapy, but yoga, at least here in Western society, has been considered under the most mainly under the arts,
Yeah.
and more of a philosophy. But there is an impact that
Mhm.
happens, and you brought up the neural pathways,
Yeah.
when that reframing happens and those neural pathways start to shift and the breathing begins to shift our nervous system, we're now affecting the brain and then the brain
Mhm.
and the hormones that, so there is so much more to, what it is that we're doing. And when it comes to the physical piece, for working with somebody that does have a postural dysfunction, it's the same thing. Like we're, working with the physical, you know, it's an amazing, I love yoga therapy, but
Yes.
that's why I'm here.
That's why we're here.
I think most of us are very passionate about what we do.
Yeah, but it's so interesting because like you're saying, there's that neural part that I think can sometimes get not overshadowed, but forgotten a little bit that what we're doing while we not and we do there's a huge part of like when we are working with a client, the education piece, and that's where we're really getting more into that nitty-gritty, maybe talking more about what's actually happening in the nervous system. Like we are nervous system educators, I believe, as yoga therapists. We are most of what we study is how to influence and support the autonomic nervous system. So we do learn in our studies how to, you know, influence those more rest and digest states. I feel like that's a really hot topic online is like parasympathetic versus sympathetic nervous system, but knowing like there's that nuance in how we support and attune to someone's nervous system by understanding like some people might be just naturally more activated by breathing. So that won't be a tool that we'll use with someone. So to understand like everyone's body, it's not just black and white. It's not just sympathetic
Yes.
nervous system and parasympathetic nervous system. There's this uh yeah, just more nuanced perspective of the nervous system that I think as yoga therapists, we are skilled in understanding the co-activation of the different segments of the nervous system. So even with a freeze state, it's like a co-activation of, that dorsal vagal state, if you're going to bring in polyvagal theory, and the sympathetic nervous system. So
Social engagement.
yeah, the
Yeah.
social engagement, yeah. But there's a true skill that's involved and a knowledge of what's happening in the nervous system that
Mhm.
really important, and that's a distinguishing factor between being like a yoga teacher and a yoga therapist is there's this level of education in understanding the nuance of when you're working with a human being. It's not just okay, put someone in a pose and they're going to be okay. It's like you have to understand the therapeutic nature of how to hold space, that therapeutic container, while someone is having a difficult, maybe emotional uh, experience. Even if you do bring them in a pose, okay, what's their body doing? Like we are constantly observing the person. If there's those little subtle changes in their breath, their body, their posture, and taking all that in as information to be able to support that person in making the changes and they want to make in the goals that they have.
Right, right. That's awesome. Thank you.
You're welcome.
I'm really enjoying this. I can go on with you for hours, as I'm sure you already know, but as we, start to come to a close, I'm wondering, How can people find you? How do they know where to find Jessica Buck? I know
Yeah.
that we already know that you're coming out of New York,
Yes.
but
So you could find me in my practice. My private practice is here in Warwick, New York. I have in-person sessions currently at a location called Vastu Health Center here in Warwick. And my website is a great place you can find me and my work for virtual sessions. And if you're local, my website is yogamindedbygess.com. And on Instagram, you could find me at sincerelyjessbuck. I post on there sometimes, and on Medium, which is where I post my writings and contemplations on embodied spirituality.
thank you. So, as we wrap things up, is there anything else that you would like to share that maybe we didn't cover?
Uh, I think we've touched on so much good things today, and I think, I guess, just the heart, I guess, of yoga therapy, I think it really is like freedom and like the integrity to like be your true self. And if there's anything that's like a huge takeaway is to be able to reduce the fear, right, of life and to be able and open to take risk so you can uh, just reach like your full potential and not be held back by conditions that feel overwhelming, but to feel like confident and trust in something bigger than yourself.
Yeah. Thank you, Jessica. Thank you for being here. I really enjoyed our conversation, and I hope maybe you'll come visit us again.
Oh, 100%. I am so thrilled that I was even asked to do a podcast episode today. And I thank you for having me here and taking this time. It is amazing that we can help spread this message of yoga therapy. And I just can't thank you enough for having me on.
Thank you.